We're going to get back to our breaking news at 6:44. President Trump and First Lady Melania Trump testing positive for coronavirus. A live picture right now from the White House where they are in isolation. A White House official says the president is experiencing mild symptoms. We're waiting to get more information about that.
In a statement, the president's doctor said the couple will stay at the White House while they're being treated, and he adds that he expects the president to continue carrying on his duties without disruption while he recovers. We're going to keep you updated on all the latest developments throughout the morning. And right now, we do want to bring in Nurse Alice Benjamin. She is a clinical nurse specialist and an NBC4 contributor. Good morning to you.
Good morning, everyone. Thank you for having me.
Yeah, thanks for being with us. We just learned, like we said, that the president is experiencing mild symptoms at this point. So we want to talk about his risk factors, why he's maybe at a higher risk for those more severe symptoms that could kick in.
Yeah, so when we're looking at the president, obviously we're looking at things like his age. The president is 74 years old. And what we do know is that people over the age of 65 are more likely to have complications from coronavirus. And in fact, 80% of people who've died from coronavirus have been over the age of 65. And as well as we know, last month, 1 in every 3 patients hospitalized were between the ages of 65 and 74. The patient also, height and weight are a little arbitrary, but his BMI, the president clinically classifies as obesity, having obesity. And we know that according to the CDC, obesity triples the risk of hospitalization for COVID-19 and is also an inflammatory marker. And per a previous physical from Dr. Jackson, he takes cholesterol medication. He's on aspirin. There's been some discussion of him having atherosclerosis. So all of these things puts the president at higher risk for having complications.
And Nurse Alice, is there anything that the president's doctors can do right now to offset this diagnosis? We've heard about remdesivir and convalescent plasma therapy. Are these possible options for the president?
Well, those treatments are reserved for emergency use. Remdesivir, convalescent therapy, IV treatments, we generally reserve for those who are hospitalized and severely ill. Right now, it's a wait-and-see game. The president seems like he's starting to report some mild symptoms. We're just going to have to see how this goes and manage his symptoms as they go along. Because they're, remdesivir, convalescent plasma, those treatments are available, but to give them prematurely can also have their own risks. So right now, the president's just going to have to take better care of himself and really put some thought into his lifestyle, because I think a lot of his lifestyle, his cavalier attitude, has contributed to some of the reason why he's been exposed to COVID-19.
And we talked about, obviously, we all watched it, the president sharing that debate stage with Joe Biden 3 days ago. They were pretty far apart, a good distance, but not wearing masks. Is there a risk level for Biden as well in this?
Absolutely. So when we look at someone who's considered a close contact, we look at someone who's been in 6 feet distance for more than 15 minutes. Now, on the stage, they look, pretty far apart, but we don't know what happened off stage. The gentlemen were not wearing masks. They got a little heated during the conversation, so those droplets, I'm sure, spread a little further than 6 feet, and we don't know what the ventilation was like in the building. Were there fans on? Was the AC rotating, COVID-rich air in the room? We don't know, but I can definitely say that not wearing masks, being around someone who has tested positive, does put someone at risk. And if you are someone like Joe Biden, at best, you should be quarantining yourself to prevent the spread to other people.
All right, Nurse Alice, thank you so much for your insight there. We appreciate it.
Thank you so much.
All right, we'll talk to you soon. All right, 6:47 right now. We could get the reopening guidelines for theme parks in California as soon as today.
Yeah, they will be issued by the state